Good evening and welcome to this evening's Horse Sport Ireland coaching webinar, everyone. We are delighted to welcome back internationally renowned sport horse farrier Haydn Price to host the second webinar in his series titled The Hoof Capsule, Form and Function. This webinar will cover a number of questions which coaches have raised in Haydn's two previous webinars that he's delivered for Horse Sport Ireland. I'm sure you'll all find it very interesting and educational. As I'm sure many of you are aware, Haydn is a wealth of knowledge and is extremely well regarded within the industry. In 2011, he was awarded the British Equestrian Medal of Honour, and in 2013, he was inducted into the Farrier Hall of Fame.
Thank you very much. Well, good evening, everybody. I have to tell you, if you see me supping a quick cup of tea, you see I've got my mug there. I'm a man that's got a cold, and we all know that a man that's got a cold is not functioning very well. Anyway, we've got an awful lot to get through. If I suddenly start coughing and sneezing, I'll apologise and then come back again. But we've got a lot to get through in this section. I'm absolutely delighted, to be honest with you, that we've had an opportunity that you can control an awful lot of the content here. This is the whole point of this, really, is to create presentations and webinars and series of these for the questions that you've got. I'm not sure I'll be able to answer all of them, of all of your queries, because it's so much information and we'd be here for an awful lot longer. But we're going to go through quite a few of the material that you'd asked for. If there's anything that we've left out and you wish another one, I'm sure at a later stage we can accommodate that for you. Okay, shoeing in its entirety is about selecting an appropriate shoe platform, really, isn't it? I mean, it's fairly standard. It's well executed. It's well thought out. But what does the shoeing platform actually do? Now, we touched on this a little bit before because we talked about shoeing different types of shoeing and how that can change the internal component, how it can affect the position of bones and how it can affect joint range of motion as well. This session, we're going to talk a little bit more about those sort of things and some examples for you as well of the different types of shoes. Some of it will be basic and you'll already know. Some of it, hopefully there'll be one or two little messages in there that perhaps you're not that familiar with. But for me, shoeing has always been about creating an appropriate platform, irrespective of what you're doing, whether you're just, somebody who's happy to go out on a Sunday afternoon, when the sun's shining for a happy hagger, or whether it's a performance horse in any shape or form of any discipline. If the old adage, I suppose, no foot, no horse is all very well, but actually, there's an awful lot more when we start looking at performance horses in particular, and certainly horses that are competing at a high level. We're micromanaging. We're looking to see, in fact, is there anything that we can change? Is there anything that we should change? Because you don't execute change for change's sake. There has to be a positive outcome as a result of what you are likely to do, in exactly the same way from a coaching and training point of view, that you will not change anything unless you are expecting a positive outcome. In basic terms, there are two basic categories of horseshoes, really, for me. One is the open heel, the one that we're very, very familiar with on probably 90% of horses. The other one is the closed heel. I suppose when you're looking at elite equine athletes, we deal an awful lot more with closed heel because we may be protecting something, we may be preventing injury, we may be trying to enhance a performance. So a closed shoe is probably more appropriate in performance horses than it is anywhere else, and unless you've got an injury. And there are two basic profiles. I'm sadly, very sadly, old enough to remember that the basic profile that we used to have in this country is the one on the left-hand side. It's concave. Concave was designed to give grip. It was designed for fast-moving horses to enable them to give grip. It was our European colleagues that introduced us more to a fullered section, which is a three-quarter section. It has major benefits in dispersing and the because it's a wider section, it can disperse that pressure that's associated with downward movement from body mass and ground reaction force from coming up. So it's a much more supportive element. And it was our European colleagues that introduced us to this. An awful lot of horses now are shod in this fullard section. Some of it is 3/4 fullard, so it's blanked off in the toe, as you can see there, and some of it is a fully fullard section. But it's a squarer section. It gives less grip, so but it gives a lot more support. There's an awful lot more that you can do with that shoe to give support, especially when you're looking outside the hoof capsule, which is something we're going to come on to in a minute. And I suppose out of the categories that you have of closed shoe, they fall into these. Starting on the right-hand side, my screen on the right, you've got the straight bar. Then in the middle, you've got the heart bar, and then you've got the egg bar. All of the three shoes as a closed shoe offer some form of protection, but they work in different ways. I think the egg bar shoe is something that historically we inherited when we had a lot of thoroughbred breeding. We had a lot of long sloping hoof pastern axis, and then we would give a support shoe in it with an egg bar shoe. An egg bar shoe was probably the most prescribed shoe from veterinary terms, and applied in farriery more than any other shoe at all. It has disadvantages, the disadvantage being that because it's an oval shape at the heel here, it offers little protection, may offer support from a platform point of view, but it offers very little support inside the solear aspect of the foot. It's much wider and it's much bigger and much longer. So an awful lot of these were inappropriately applied, offering too much support in the heel area, right here, by the time it was fitted. So in the heel area, it would offer the support there, but actually this part of the foot here, the palmar aspect of the foot, didn't have any support at all. So unless you put packing, some form of packing in there with an egg bar shoe, you were likely actually to create bigger problems for yourself than cure them. Much more common is the straight bar shoe. That's, again, it will offer support to the back part of the foot, the palmar aspect of the foot. And then the heart bar shoe, then, by virtue of its name, the heart shape, the plate in the middle, then used to give protection in and around the margins of the frog itself. Commonly used for laminitics, probably sort of 20 some odd years ago. We now use modern materials instead. So those are the two basic sort of types of shoes that we get: closed heel, open and open heel, and the reasons why we use them. And this is just an example for you, a nice radiograph showing that, in fact, if they are appropriately applied, a closed heel shoe can give tremendous support to varying parts of the internal mechanism, whether that be skeletally or whether it be soft tissue. So you're looking at tendons and ligaments. I made the point in a previous session, didn't I, that, you know, has farriery advanced its ability to be able to shoe for specific conditions. I'm going to come on to some of the shoes that we find in a minute and have a brief discussion about that. But I think from a farrier point of view, we have to be far more aware of the anatomy and physiology of individual structures and what their function is, form and function, for us to be able to rehabilitate a lot of these. Putting just a straight bar shoe on just to protect it is no longer acceptable if, for example, it might have been an injury to the impart ligament or the navicular bursa or the collateral ligament. But put that to one side, that's the technicality side of it. In basic terms, that what this photograph shows you, what this radiograph shows you, is the fact that a closed heel can give support, which is why it was designed. But it isn't just in front, it's behind as well. So you can, and our ability now, because we have sort of welding inserts and all sorts of things, the photograph on the left here, you can see that this is just a normal shoe, and this is a normal shoe that's been converted, a hind shoe, to a straight bar shoe just by placing a welded insert. The one on the right, slightly more complicated because this is an omniradial, which we'll come on to, omniradial shoe or omnidirectional shoe, and it's got a heart support in it. Although they're two support shoes, so we've gone from open heel to closed heel, but an awful lot more thought gone into it, and that would be for specific areas. So you may want to put that on if you've got a prolapsed heel, or you may want to put it on as a protective measure for soft tissues or perhaps navicular bursitis. That's not the only shoe that you could use, because to me, it's about journey and destination. One shoe isn't necessarily on its own. One prescribed shoe isn't going to give you what you want. It is how it is applied. And I've seen other people use different techniques. I've referred to it many times. It's the journey and destination. How you get there is entirely up to you. Two different clinicians, two different farriers may use different approaches, but they end up in the same place. And it doesn't matter how you get there, as long as you end up, as long as it has the desired effect and that you affect the form and function. But we have seen an exponential increase in prescription horseshoes. I have an opinion. Some of them are good. I have an opinion. Some of them are very useful. I think it's very dangerous because I think, and particularly, I'm fortunate enough, I've made a lot of mistakes. It's the mistakes I've made that enables me to say that if I do this, this, and this, I think that on the balance of probability, you'll get that. But it's because of the mistakes I've made. The problem I've got with prescription horseshoes is it almost takes away the thought process. For me, I have to get into the intrinsic values of what you're trying to achieve. And that may, in some cases, may be quite complex. If an MRI report comes back, and actually I've got a horse here at the moment that came back with a very confounding MRI, and the only way that I can really get to it is to have this horse with me for just a couple of days so that I can get into the horse. I can see what it's doing. I can see how it's moving. I can measure certain things. And I can see it on day 1, I can see it on day 2, and I can see it on day 3. That's an exceptional case, but this is quite a confounding issue that we're dealing with here. The danger with this is that a prescription horseshoe for a collateral ligament or for a navicular bursitis can be pulled off the shelf. It can be applied, and yes, it may help, but actually it takes away the thought process of why did this horse get this in the first instance? Proactive shoeing is far more appropriate than reactive shoeing. Reactive shoeing, anybody can do. The real secret for me is how do we prevent this from happening again? Can we prevent it? Sometimes you can't. That brings me nicely on, for me, with the engine. I, again, grew up with lamenesses occurring in front limbs. By far the majority of horses that were lame in front limbs. I've always been interested in what's happening on the back end, what's happening to the engine. How are these limbs working? How does a horse compensate for itself? We have all of these different diagnostic elements now in veterinary medicine, farriery, and just about everything else that will give us the numbers, and we can understand it. I actually like to quite figure out why it's happened in the first instance, because if you can reverse the engineering that's created it, you're going to have a horse that is going to live longer and be performed for a longer period, and hopefully at a higher level as well. So there's often a requirement to support the hind limb as much as there is in front. Now I'm teaching Granny how to suck eggs, because you are the very people that have known that far before I think the majority of us, the farriers, knew about it, because you could see horses, you watch horses moving, you change the profile of that horse in a different way. And you can get a better picture, you can get a better performance out of it. but how do those limbs compensate for one another? And I think it's only relatively recently, I would say in the last 10 years, that I think farriery is really beginning to understand now that if you've got a left fore issue, lameness, you need to start looking at the right hind. And very often, if you sort the right hind out, or if you sort the back end out, the front end will take care of itself. And I think that there is far more awareness now of how we can influence, and how don't necessarily look at the affected limb, look at the horse in its totality. So I wanted to show you this. This was our horse, actually. It was far too long ago for me to recall. This was a thoroughbred mare, an eventing mare. It was Rachel's, my wife's. It was homebred, and it had an injury to its left hind limb at a young age. Now, the reason I put this in is that this is barefoot at the moment, and it's on the one on the left is on an abrasive surface. So the foot is holding. The foot is holding, and the segments of the hock and will change depending on the underfoot conditions. Because if you look at the right, we haven't changed anything at all other than just gone around the corner and popped this horse into the indoor school. And suddenly you're seeing limbs that are moving a lot more. So the rotational value of that hind limb is exaggerated through changing nothing at all other than the underfoot surface. And individual hind limb rotation is a very, very common occurrence, but it depends where that originates. Just go back just 1 second to this mare, and if you look at the pelvis and you look at the hind limb, it's not moving much, but the hock is. So it's like a hot wobble, if you like, for want of a better description. Then you start to see the upper portion of the segment moving a little bit more on this surface. So nothing's changed other than the surface. So this one is a real interesting one, because when we look at a limb rotation, what are you seeing? And this has caught an awful lot of farriers out, an awful lot of vets, because under normal circumstances, and we're going to come on to these, it's quite common now for a horse to have lateral support behind. Lateral support is something that is commonly requested. So when I show this video, this was a horse that competed at Grand Prix, and it actually it competed for Great Britain at the Olympics a number of years ago. So you are talking about a horse that was at the top of its career, and yet it was perfectly sound. The difference is this whole limb is rotating, and it's rotating from the pelvis. So if you was to say to me, okay, Haydn, can you have a look at this? What shoeing protocol would you prescribe for this? I hadn't shod this. This was a yard visit that we were doing, and I took some gait analysis, some video gait analysis. I wouldn't be changing that, because the orientation of that, or the origin, I beg your pardon, the origin of this hind limb rotating as it is from the pelvis. If you do anything to the support mechanism in the way of a shoe profile on the end of this foot that prevents that limb from rotating as it is, then the chances are you will create a major problem, and potentially a catastrophic one as well, because the limb wants to rotate from the pelvis. So you can hypothesize as to whether this affected this horse's performance. Indeed, if the pelvis didn't rotate, it may have performed even higher than it did. Even its results may have proved in the results. But nevertheless, there is absolutely nothing I would do with this in the way of changing a shoeing procedure. Where necessary, a platform that exceeds the perimeter of a normal foot can though often help to stabilize a limb in the stance phase. How did I come about this? I was confused. I was why so many horses sort of 20, 30 years ago, were having hock problems. There was pathology within the hock itself. And it set me down a road, why is this happening? Why are we seeing so many cases with horses that are having pathology within the hock? And then we would see the sort of medication that we're all familiar with and is absolutely necessary in some cases for horses to continue to perform at their optimum. My thought process was, is there a better way that we can stabilize the limb? Because remember that horses, unless they have an injury, unless they have a strike themselves, horses injure themselves on repetitive strain injury at the stance phase when the limb is being loaded. Repetitive strain injury, every single time it's trained, every time the limb is loaded. So these hocks were wearing out basically at the stance phase, not at the swing phase. So we didn't need to worry about what was happening when the limb was in its aerial phase. We needed to concentrate on what was happening in the stance phase. Is there a better way that we can stop that displacement of that hock sort of going laterally? Because the minute, of course, it does, that means that you get out of plane loading parameters on the joint itself. Now, I like to think in simple terms. That was the most basic way I could sort of think about it. But of course, when you talk about lateral support, there are varying interpretations, some of which are appropriate and some of which aren't. And this just happened to be a horse that came into me that somebody put a lateral support shoe on. So I thought I'd take a photograph of it. And to me, if something looks wrong, it invariably is wrong. You might not know exactly why. You might not know exactly where it is wrong, but if it looks wrong, and that to me looks fundamentally wrong. That to me, if you actually look at the profile of the outside, it's a continual radius. So the radius on the outside here from the heel quarter continues. It doesn't suddenly change. This one, the radius on the outside, suddenly there's a lump of steel which is sat on the side there. So it may well support the limb at its optimum stance phase, but I don't like bits of steel stuck out and literally just welded on. To me, it has to look symmetrical in some shape or form. So I suppose the question is really, do we have a subjective opinion or an objective measurement? Well, only today we were taking some data. We can look at horses and we can have an opinion, and 2 people or 3 people can have 2 or 3 different opinions, or you can all agree, but it's still subjective. What I tend to do with these horses, and certainly with the horses that we're trying to get as comfortable as possible, if there are multifactorial elements, or if the horse is not symmetrical or not performing or weak on one side, on one limb, then we tend to use objective measurement. So when I'm looking at pelvic asymmetry, we use the aggregate gait analysis system, which is basically inertia measurement systems. So it will give you propulsion, it will give you loading parameters, and we can start to look at the individual limbs. We can look at the pelvic, we can look at the tuberococcyx, we can tubosacrali, and we can actually tell them whether a horse is loading and pushing off equally. And that's behind and in front. So we can make the necessary changes that we feel appropriate. We can make those changes and we can repeat it. So it becomes an objective measurement and not just a subjective view. So this is some that we done, as I say, many years ago, and we used the video-based system as the only system that we had in those days. So we used the video-based system because what I wanted to know is, could I support? I wanted to know what was the difference between the left hock and the right hock, and secondly, if we executed the change, could we measure that? So we were able to track it. So the limb on the left is no support, and then we applied lateral extension, and then on afterwards, and we then remeasured it. And this is the sort of thing that you got. This is the variance between the left hock and the right hock. So this is pre-intervention. This is just normal shoes. So then we can repeat it, and then we can start to put values to it. And the values that we put in this particular instance was that we had a 28% reduction in the lateral hock displacement between the lateral support shoe and the ordinary hunter shoe. And that's quite dramatic. What was of interest to me actually was, if I actually look at it, we also calibrated. We also took the data and calibrated this unshod as well. And the lateral extension shoe and the onshod were similar, very, very much similar. And there's an awful lot of people out there and advocates to say that, you know, sometimes you're better off taking your shoes off, and sometimes these horses will find their own way, which I have to say I am definitely in agreement in certain cases. But equally, if a horse is shod appropriately for that limb, this graph just shows you that you can potentially get a horse to load and the limb to react in a way that it would be unshod anyway. And that's really for people who are major advocates for horses should always be barefoot, and I'm not altogether in agreement with that. So appropriately applied lateral support shoes offers stability. That's what we're looking to do at the stance phase on the loaded limb. We're looking to support that limb as much as we possibly can. And not all horses need lateral extensions. Not all horses need support shoe laterally. But I think in veterinary medicine and evidence has suggested now that if for example, if a horse is being scanned and it's got a high limb suspensory, the first thing that they will look at is to see whether there is lateral support to that limb, because we do know the tighter that you shoe on the outside and the more displacement that you're likely to get as that limb is loaded, then the more torque effect and the more peak force there is on the suspensory apparatus itself. So support is definitely a key area. And I think the other message that I'm desperate for you to take on board really is an individual shoeing protocol for individual limbs, because just because you put a lateral support shoe on one limb doesn't necessarily mean to say that you need to do it on the other limb. Each limb should be treated in its own entirety. If the left limb in this particular instance is rotated more than the right, naturally rotated in its conformation, and it comes underneath the center of mass too far, then it is that limb that's going to need the support, not necessarily its opposite number. One thing you've got to watch for, though, is that very often you'll see a pelvic drop. And when you fit a true lateral support shoe, then the chances are that you will, over a period of time, you will even up that pelvis. And it may be that a little bit more support then needs to be put on the opposite number. There's a really good simple exercise for you. This was a horse that we shod, Grand Prix dressage horse that we shod on Sunday. He's 17 years of age. He's had a very good career. And he's got this you'll see in the right hind here. And this was after we shot it, and I suddenly thought, oh, I'm doing this tonight. What I'll do is I'll take a photograph. So you can see the asymmetry there on the limb itself. This being the outside, so this is the right hind, and that's the shoe fitted. It's slightly wider on the lateral side and a little bit longer than its opposite number on the inside. Now here's the key for you. If you want to see whether that shoe is in fact in a supportive plane to the limb, don't stand there and look at it as you see in this photograph, because when you're up close and personal to these things, that's all you see is material stuck out the side of the horse's foot. Walk the horse between 8 and 10 meters, 8 and 10 paces, and draw a line, and then get that horse to stand up, because the photograph on the right is exactly the same horse, just 8 meters away, where the photograph is taken. Now, when you look at the sort of what I refer to as the tram line, so you see, when a horse is freshly shod, this is how we finish them up. We've got the tram lines here because they come off the linisher. Now, when you look at the tram lines on the medial and the lateral, inside and outside, relative to the limb, it looks even. It's not asymmetric. And that's the difference between, for me, between a horse that has an appropriately applied support mechanism. So these bits that are just welded on the side, you would not see that, because you'd have a big thick lump of material now which would be sat on the outside. But it's a really, really good reference. And when you walk these horses, if you walk about 10 meters and then put a line and imagine a line, and you get this horse to walk away, I will absolutely guarantee every single case, by the time it gets between 8 and 10 meters, all of that material on the outside that was stuck outside there, when you're looking at it, will completely disappear. And then you'll see this limb working in line, and the platform will be parallel to the loaded limb. But it's a really good, simple exercise to do. So moving on, somebody asked about side bone, quite common. The side bone, as you will be acutely aware, is the ossification of the lateral or collateral cartilage, the two plates of cartilage that sit. This is an overlay. This is where the cartilage sits and attaches itself to the upper portion of the bone, just of the peel bone, just here. It can be unilateral or bilateral. So we can have one side affected or the other side, or both sides. These are the two collateral cartilages. I think they're probably one of the areas that are probably just ignored, really. The collateral cartilages to a certain extent. They have a major part to play in the expansion and contraction of the foot. They have a major part to play in the biomechanics, internal biomechanics, and they're sort of misunderstood. They're actually quite thick. They sit and they can actually, the top of the collateral cartilage, you can just above the hairline, you can just place your finger here and you can press it, and in a non-ossified collateral cartilage, you can push it and it will yield to thumb pressure. It's always a really interesting one, where the horses are being sort of bought and sold, as you well know now, and they're being vetted within an inch of their life. And then all of a sudden, a radiograph will show that the horse has got unilateral 1 or bilateral 2 ossification of the collateral cartilages, and they'll say, oh, all right, okay, we're going to make a judgment on it. I've seen horses that have had unbelievable side bones and never had a day's lameness in its life. I've seen horses that have very small changes and to the collateral cartilages as they slowly ossify and turn to bone, and it has created big problems. So it's always a very difficult thing. I feel very sorry for vets, to be honest, when they're asked to vet these horses, that all of a sudden this flags up. And I often refer to it as, is it a red card? Is it an off, don't touch it with a barge pole? Or is it a notifiable change that actually, on the balance of probability, isn't going to affect your horse? It's not much help to the purchaser, but I think it's very unfair to give an opinion as to whether a horse's progression through its performance is likely to be affected purely because of side bone. And here's 2 examples for you. So this one here is the beginning of ossification of the collateral cartilages. You see those 2 holes there and there. And if I just bring this up, because I've just if I just bring this up just a second, I can see, yeah, I can see now, see my camera. So those two holes there are, if I can show you, I can just show, yeah, is just here. And those are blood vessels, and they sit in here. So the collateral cartilage itself is attached, and you can just see that bit of protrusion that's on there. That's just a bit of ossification of the collateral cartilage there. So when it does start to ossify, this will bridge over, which is what you're seeing just here. Those two holes are the holes there. That is the blood supply there and there. But they're not too big, and they certainly don't affect any of the joint. You can see now when we look at this one here, we've got two massive side bones. So we've got bilateral side bone, but it's actually got one stage worse because both of them are fractured as well. This one's fractured and this one's fractured. Believe it or not, these photographs were taken and the horse had just come back from competing. It was an event horse and had just come back from competing on the circuit in Europe, and it didn't seem to affect it at all. So let's go back to our shoe. Let's go back to form and function. So an open heel shoe, there's an example of that horse on your left-hand side with an open heeled shoe. And it offers little protection. And there's little you can do from a shoeing point of view to offer protection to those now new bone growth, those collateral cartilages that have ossified. This is an example of a closed shoe with a spider plate. And this is how I treat these horses now. We've had some quite advanced cases of horses that we know are starting to be affected as a result of it, of the changes. So what my approach to this is that I will apply a shoe. I'll put a closed shoe on, a spider plate. I'll also put some packing in there, because by using the packing in there as well, and again, I'll show you an example in a moment, what you can do is you can close, what I refer to as close that foot down, because what we want to do is to stop the natural deformation. The natural deformation of a foot under load is to expand at the heel, is to do that, because as weight comes down, so the heel expands. Now, when the heel expands, the top part, the hairline, actually goes in. So the foot comes out and the hairline goes in. The reason why a lot of these horses are affected as a result of it, especially with advanced cases like this, is that the minute that foot expands, the hairline comes in and then it impinges on the area around here. So the actual cartilage itself, the fact that it's ossified, is not associated with the horse's pain or uncomfortableness, if you like, but it's the fact that it's moving. So what we try and do is we try and lock the foot down as much as we possibly can by using a combination of packing plus a closed shoe. That stops the deformation. If you can stop the deformation and hold the foot in place, you'll stop the hairline from impacting, and then you'll stop the impingement. And that is probably the best description that I can give you for how I approach these. And when they do get this, you can actually visibly see them as well, because if you look, there's your hairline, and the top of these sit well above the hairline itself there. So you can imagine that could cause a problem. But of course, it doesn't affect the joint. It doesn't affect the joint at all. The rotation of the joint is unaffected by this completely. This is the example. So polyurethane impression material. So it's a high shore rated material, two putties you mix together. You put that into the back part of the foot. This is a thermoplastic. This is a plastic that you melt. So I have sheets of this that you melt in boiling water. Then you apply that on top of the foot with the impression material underneath. So you've locked this in place now, because as it then cures, and you can see this is not quite cured at the toe, it cures with air temperature. So the cooler, the quicker it cures, but it has cured here. and it's gone a white hard plastic, within a couple of minutes, this will be a very, very, very hard plastic. Now that foot cannot move. It is essentially locked down. So even with weight coming down through the limb and with the ground reaction force coming up, the foot doesn't expand. You reduce the expansion of the foot. Somebody had asked about studs, a necessary evil. I think they are absolutely necessary. Thankfully, we're seeing slightly less of the use of them now in performance horses, because we've moved on from grass arenas to all-weather arenas. Still very evident in event horses and polo horses. There are very few studies that have been done on studs, because the first thing that people will ask you is where should you put the stud? Where should you put the screw-in stud? Should you use one? Should you use two? Again, I've been around long enough, and I know John is listening. He could give you a lecture on this with his show jumpers. We've even had situations where a 4-stud configuration, 2 at the heels, 2 at the toe, has not been uncommon. So the horse absolutely plants that to give that foot and that grip. The hypothesis is it a good thing? Does it create shock loading? Yes, it does. Does it create an increase in vibration? It certainly does. But I generally find that riders will have their preferred configuration, and I never interfere with that. And I never interfere with it, because God forbid if you were in Aachen and you lost the Grand Prix in Aachen because you had said, I would change your stud configuration. There's only one person whose head is going to be on the chopping block, and I don't mess with things like that, to be honest with you. By and large, I think it's safe to say that studs 1, 2, or 3 or more. This photograph here is for a polo. This is a polo shoe, and we know what happens with polo. There is one stud in the outside because that limb wants to hold and it wants to rotate very, very quickly, so they want to spin on it. That's the reason why generally this is my preferred option, which is to put 2 on either side. And I think that's more or less the general consensus now, that they'll have 2. And then they'll change the stud size depending on the underfoot conditions. So whether if it's really wet, they'll have a thick stud like this one here, a big square one. If the ground is slightly harder, they'll have one here. This actually, believe it or not, is a road stud. That was designed as a road stud, so they can pop one in. So you can imagine if you put one of those studs like that in just the outside heel, you can imagine how that limb is going to be affected by A, having one locator on the outside, and B, the medial lateral balance is just awful. And quite a few studies have been done on that with drive-in studs. But driving studs are a thing of the past. These are these awful things that we used to have. We used to have a hole and used to put these in. This is now the type of thing that you're likely to see. That's a 4.3 millimeter tungsten carbide pin, and all of our horses, virtually everything that we shoe, unless they never go on tarmac roads, has these in, because again, for a safety feature. I would hate to think that anybody was injured or any horse had slipped. Remember what I said earlier on, that these profile shoes, these fulled shoes, the wider section, flatter section, doesn't give you as much grip, so you're going to have more slip. So it's a trade-off, isn't it? If you need that to support the foot more, to distribute the weight over a wider area, the chances are it's going to slip more. So you've got to have something in there to prevent it. But this is by far the most common effect now, the common use rather. 4.3 millimeter tungsten carbide pins, 1 in each heel. And that's what we tend to do. Somebody asked about the omnidirectional spider plate. How does it work? If you speak to a lot of older farriers, they will say to you that when you freshly shoe a horse, that it will take that horse a little while for it to break those shoes in, if you like, because the where the foot breaks over, it will want to take the leading edge off. That's exactly what this shoe does. It doesn't have, because the leading edge is taken off. If you've got a horse that has a pathology there, bearing in mind that horses will adapt to whatever the problem is, or whatever it is they're trying to walk off, whether it be unilateral side bone, whether it be a sore foot, whether it be a problem inside, they will adapt their gait to try to compensate for it. What this does is a beautiful shoe that gives a horse an ability to be able to break over in any given direction that it likes. There are several other factors with this. Because the leading edge is taken off, it means that the weight transfer is orientated away from the wall itself, because the wall is like a cone. It's like a cone shape. So if you put a shoe on the edge, the weight bearing here, there's a certain amount of force that is taken on that weight bearing structure, being a cone shaped. The minute you put an omni-radial shoe on, that is transferred internally. So there are a number of reasons why you'd want to use this. Internally, laminal inflammation, not laminitis, laminal inflammation is again something that's quite common. You take load bearing off the wall itself, can be a good thing. And a host of other things. This is my go-to. One of these shoes, a spider plate, and a spider plate with packing, which is in this one here. Again, this has got an ultra soft packing in it, but a combination of a spider plate shoe with packing will cover a multitude of sins. Not everybody has got the ability to have their horse MRI'd. Perhaps they're not insured. MRI to find out, these values or these problems inside feet can be very, 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 very costly. So my go-to in every single case, if I'm looking at the potential of navicular bursitis, collateral ligament, impar ligament, splitting the DDFT in initial stages, is to put one of these shoes on to try to get the horse more comfortable. And without a shadow of doubt, it is my go-to if I haven't got anything that I can actually hang my hat on and say, it's had an MRI, it's got this problem, this is the shoe that we're going to use for it. Moving on to double clip front shoes. Somebody asked about double clip front shoes. The general consensus of opinion, if you ask why do people fit double clip front shoes, if you ask a lot of farriers, they'll say it controls the dorsal wall angle. So instead of having a toe clip, here you have the quarter clips, and it means that you can set this angle back, this dorsal wall angle back. So it controls the dorsal wall angle, and it influences breakover because you fit it just underneath the toe, and then it's easier for that to break over and to break forward. That's the hypothesis. I have to tell you that it seldom works. It does work on certain feet, and the photograph that is in here that is showing you, this is absolutely the type of foot that it will not work on whatsoever. The foot is really wide. You can see that you've got flaring or creeping, as they call it now. You've got this, it looks wider here. And the one thing that I repeatedly ask farriers is, when you fit double clip fronts, are you continuously coming back and taking the toe back? And they say yes. So, well, you're not controlling the toe. The first sign of insanity is keep doing the same thing, expect a different outcome. So if you're fitting, if this foot is the sort of foot that has got a long, and this is a classic one actually, it's got relatively long, when you look at it on the solar plane, you fit double clip fronts on there, but you're constantly, every time you come back to reset the shoes in the shoeing cycle, 5 weeks later, dress the dorsal wall, dress the dorsal wall. So I say, well, if you're dressing the dorsal wall, it's not doing what you're saying it's doing. And there are, again, an awful lot of horses like that. This is my half-baked attempt to show you what happens, because my drawing on a computer is not brilliant. This is what happens. This is a horse that came in and it had double clip fronts on. So there's the one clip, there's the other clip. And if you just follow your eye with the radius around here, so you've got a radius here up to there, you've got a radius on its opposite side. It doesn't matter whether it's the inside or the outside, and it's fairly constant. Then all of a sudden, you've got what I often refer to as a tongue. It sits, you've got a second radius that sits at the toe, just here. Where are we? Just here. So this second radius, because if you continue that radius with your eye around here and around here, you'd find that it would probably come to about there. And then you follow it all the way around and you marry it back up again with this opposite number, you'd have a lovely symmetrical shape. The other telltale sign is the distance. Look at the distance from the tip of P3 to the end of the dorsal wall. And that fingernail is basically just stretching. Now, some people think that double clip French, that they impinge that area, so they squeeze that area and they send the toe out. There's not been enough studies. One or two people have done studies on this, but it's not easy. You need a lot of horses and you need to measure it over a sustained period of time for several months for you to be able to map how that foot changes over a period. But that is an example of why I don't like using them, because the dorsal wall in this case is not being controlled because you've got this second radius stuck out the front. So what you do is you come and refit your shoes, and the first thing that you do is take the toe back off again. You dress it forward, dress it. So it's showing that you've got deformation of the white zone, deformation of the white line. Here's another example for you. And there's one different horse. There's the radius, comes to there. And even if you filled this bit in and continued the radius, you'd find that it would be shorter here than it actually is. And look at the dirty, admittedly, white line. Look at what's happening here at the white line. It's being extended. So to me, those are two examples of why the shoe doesn't work. Because this one had a really thick, solid hoof capsule, we were able to do this. And I took this, it didn't dress the foot first. I just notched that toe clip in there. And you can see how deep that is. You wouldn't get away with this with the majority of horses. And what you would do then is not put any toe clip on at all. So you would reset it by offering a toe radius which is symmetrical. Now we've got a radius which is the same all the way along. This was the shape of the foot beforehand. These were the clips. That was the great big notch that I was able to put in there with the toe clip. And this was it after it had been finished. This horse was unaffected by it. But an awful lot of horses, when you get this stretching effect here in the toe, if you put a big clip in there, the chances are the horses are going to feel. You cannot do this at all unless it's under veterinary prescription, because some of these horses will need medication to help them get through that. They will get sore-footed afterwards for a very short period of time. And normally, if we are going to put these horses on painkillers, anti-inflammatory, it would be for a period of 4 days just to let everything settle down again. But this one has got some webbing in it because it's already, I wouldn't do that. And I wouldn't notch this in and put this shoe on without putting a support mechanism underneath. Because now I've taken load off the wall and we're using some polyurethane pouring pad in there. And what that does is then it takes the load bearing off the wall, transfers it onto the sole itself and supports the underlying structures as well. So I'm not an advocate for double clip fronts. Our hour is just coming up, so we're getting towards the end of it. A guide to solia packing. Somebody else asked, what is the difference then? But if I can just refer back to the original one we done with this study that we done down here, and just to remind you, what we done is we looked at a number of horses in the lab, and then we put them through the CT scanner, and we changed the packing material. When we talk about shore rating, every single plastic that you have, that every bit of anything that's plastic or rubber will have an industrial shore rating. And the shore rating is its industrial rating to its hardness, its density, and its flexibility. All polyurethane packings that we have, and in fact, all packings that go into horses' feet are what we call an A-rated, A shore rated. The higher you go up, so A, B, C, and D, the harder it gets. Hence the reason why we can have kettles that are made of plastic that you can boil, and hence the reason why you have trolley wheels that are as hard that will never, ever, ever wear out. Although they're the same material, there are different shore ratings. So these two beauties here all be the same, came out to the same foot. This one is a polyurethane pour-in shore rating. This one is an impression material, two-part putty. And somebody had asked me to explain the difference, and it basically comes into two groups. If I want to influence the underlying skeletal structure, so if I want to elevate this bone, then I will use an impression material, a two-part putty, a high impression material with a shore rating that comes out at about 60. Okay, so that then will be a very dense, hard material, so that when weight comes down, you're using a horse's natural body weight now, so about 600 kilos is coming down. The ground then is acting as that reaction, that ground reaction force, and the foot, that instead of the bones settling, it will be elevated. If we're looking at injuries to soft tissue, so if we're looking at underneath, if we're looking at the navicular bursa or the collateral ligaments or the impar ligament or the suspensory ligament of the navicular, then I will use a softer packing, and the softer packing is the polyurethane with the lower shore rating, and that's a pour-in packing, and that comes between 25 and 40. And I actually manufacture my own polyurethane packings now because I wanted to be able to be certain of the quality control. Because if you have two packing materials but they're from different companies, remember what I said before, the chances are you'll have different shore ratings, and that is why so many horses react, that you don't change anything other than a manufacturer, but then as a rider they'll come back and they're hypersensitive to these horses and say, what did you do? There's been a change. But the two groups, essentially soft tissue, lower shore rating, polyurethane pour-in. The two-part putty, the impression material, polyurethane impression material, harder, denser. That's more for the skeletal, to influence the skeletal position. And that's our sort of walkthrough, if you like, of the final part. And I need to offer a major thank you for the series. First of all, I'd like to thank Horse Sport Ireland for the opportunity of speaking to you. It's been an absolute delight, to be honest with you. And from the feedback that we've had with the questions, I just think it's phenomenal that we've got this interaction. And if you need any more, then let me know. For Jennifer for organising and this and be the coordinator, and for Shane from Traction, because the technical side of all of this, for everybody to get something out of is input is absolutely essential. The other acknowledgements I've got is the two people in particular, Professor Renata Weller, who when I've often gone to her, when I first went to her quite some time ago and said I got these soul-searching questions, I thought she'd think there was some barking mad Welshman, but instead of that, she embraced my thought process. Her husband actually is associate professor of bioengineering, and Tilo Poe, who I was with today, and we were taking some data today because I've got yet something else that I'm trying to get my head around, which is just quite exciting. Dr. Hilary Clayton for one of the images that I used in the previous ones, the images for the shoes from Stromholm Farrier Supplies, and Mitch Taylor, who took that beautiful photograph of the one you just saw of the internal collateral ligaments. And I think finally, it's all the subjects that have enabled me. I've made a lot of mistakes. I've made a tremendous amount of mistakes. I've done things and not really understood what I've been doing over the years. And I think without those horses, but at least you advance your knowledge, and as you advance your knowledge, when you look back, you think, would I do things differently now? You bet I would. But I think you have to go through that process. And I finally leave you with the next generation. This is what was my 2-year-old grandson at the time, and I just love this because you know, our job is to pass all of this on to the next generation, and you hope that somebody in the next generation, another farrier, is going to pick up what I've done and actually be able to then say, well, let's take it one stage further. But this is my 2-year-old grandson, unspeakable.
Nada. Nada.
And I think that just about sums it up, isn't it? I think I better be very, very careful. Anyway, thank you very much. I am happy for Jennifer, if you'd like to take over now, and if there are any questions that I can hopefully answer, or if you want to email them to me, I'll hopefully get some through to you after.
We have a question in from John, who has asked, if a horse regularly pulls shoes in front, which overreach boots would you recommend?
John, have you ever heard of shoe secure? If you have a horse that regularly pulls shoe off, there is a product called Shoe Secure, and it is a plastic attachment. If you've got 2 stud holes, you drill it, you apply it to the shoe when they go out in the field via the 2 stud holes. So and it's a shroud, it's like a guard that sits at the back. It's called Shoe Secure. It is designed by a Scottish lady, and they really do work. And you put those on when you turn the horse out. If you haven't got any Shoe Secures, then rather than, because there is a big debate, you know, should you have overreach boots that are longer? I'll tell you a little secret. If you're really desperate, if you get a piece of foam, just an ordinary sponge, you cut it off so you have a piece about sort of this long, about this wide. If you actually place that there and tape it in place, and then put your overreach boot over the top, then by and large they don't pull shoes off. So that's the Welsh cheap and cheerful version. As long as you've got some duct tape, and as long as you've got some sponge. And then if you're a real professional, get in touch with Shoe Secure, get your farrier to measure the foot, and these guards can just be screwed on. That's all you need, is 2 stud holes on the shoe that I showed you, and you just put 2 little they come with 2 square nuts that you apply, and it shrouds up around here, and it prevents any of that catching. But it's a really good product. It's just a bit fiddly to fit, but the sponge works well as well.
Thank you, Haydn. And for competition?
For competition, I never get involved in any tack. I never get involved in any. Actually, I saw some the horse that I was taking some data with today had the most beautiful overreach boots on, and I said to Jackie, I said, where did you get these? And Jack Jones. Anybody familiar with Jack Jones overreach boots? Oh, they were fabulous, because they did shroud at the back. A lot of these that are longer at the back, they can cause rubs, can't they? And a lot of people say that, you know, that's why they don't like them too big. But I thought they were fantastic. But I never tell my wife how to ride the horse, and I never get involved with tack or anything like that. It is way above my pay grade, and that sadly includes overreach boots.
So if he's well shod, Haydn, he doesn't need them. Is that it?
Well, I think you've got to shoot for the conditions, haven't you? On a serious note, you have got to shoot for the conditions. And I mean, that horse that you saw, that Grand Prix dressage horse, I mean, if that was kept out in on the hillside in Wales in conditions that we've seen over the last couple of months, would I be giving it as much length as that? No. Having said that, on the fields that we've got here are on banks, and when ours go out, they go ballistic. And I absolutely do not change my shoe style, and we've lost 1 shoe this winter. My wife has just lost 1 out of our horses this winter, and they do go ballistic when we turn them out as well, which is not brilliant. But just be aware that if you've got a horse that repeatedly overtracks behind and repeatedly pull shoe off, you've got to be sensible. So you, irrespective of creating this platform for the limb, you have to shoe for the conditions, and I accept that.